Hi, I'm Dr. James Boone. I'm the medical director at Hacienda Treatment Center. I'm an internal medicine doc and also an addiction medicine physician. And I've been full-time addiction medicine for the past 19 years here at Hacienda Treatment Center. We're in the midst of the opioid crisis, and everybody's well aware of what's going on in our nation with the fentanyl-contaminated drug pool. Nobody knows what they're actually taking, and unfortunately this has led to the opioid crisis and multiple opioid overdose deaths. Just want to give you some simple information about a life-saving medication that's available over the counter in every state, at every pharmacy. If you have family members or friends who are struggling with addiction, or if you're going to be around anybody that has the potential for overdose, I would really encourage you to purchase this product. Obviously, we don't have anything to do with finances or pushing some particular product, and maybe there will be other types, but at this point in time, there's something called Narcan nasal spray. This is the product. It's a simple nasal inhaler. There will be a link at the bottom of this that will give you some more detailed information, but I just want to cover how simple this is. If you find someone that's down, they are on the ground, they're poorly responsive or unresponsive, and most specifically, if they're barely breathing, if you can't tell if they're breathing, if it's a matter that they're potentially gasping or there's some snoring, you shake them, you're not sure if they're awake, this medication can save somebody's life. And there's really no reason not to give this. And let me just show you how simple this is. It comes with a pack of 2 of these little nasal inhalers. You simply open the back. There is instructions on here, but it is that you can review, but it's so simple. You take this unit out. This device fits. You put your thumb at the bottom and your fingers at the top. If somebody is unresponsive, they're not breathing or barely breathing, you can't go wrong by giving this for a possible opioid overdose. You simply insert this into one of their nostrils until your fingers touch. So if that is the nostril, you just insert that in, and then when I depress this, it delivers that mist. A single press, and that's all you do. Roll them on their side after you give that, call 911 and sit there by them. If you need to rescue breathe or to try to help breathe for them, you could do that, or you can simply wait. And the vast majority of the time, that single administration will have them breathing again within less than 2 to 3 minutes. At the 3-minute to 4-minute mark, if they're still not responsive, you've called 911, it comes with a pack of 2, you can administer that in the opposite nostril. That downtime can cause neurologic damage, can cause irreversible neurologic damage, so rapid administration of this can save a life. So please look and click the link at the bottom of this to go to the instructional information provided by this company, but this product can save a life. Thanks.